Well, hello, good morning, good afternoon, and good evening, wherever you are in the world. I'm happy to be joined by Dr. Jodie Green. We're going to use her last name, okay? But it's very confusing the way it's spelled. Gruenstern, Gruenstern, but it's green like the color stern. That's how you say it. Am I right, Dr. Jodie?
You're correct. That's why I use Dr. Jodie.
Yes. Well, we notice a lot of holistic vets are really, it's like, I don't know what it is. If it's the profession makes you more relaxed, or you're a more relaxed person, so you get into the holistic side of the profession. But we notice that a lot of vets that we come in contact with that are holistic, they like to be called by their first name.
Yeah. Yeah.
There's a unique relaxed ego that I find as compared to conventional vets. Yeah. I'll just go out and say
friendlier.
That. Anyway, so
yeah. And just like we don't wear the white coats,
friendlier, more
we wear our hippie clothes. So, and the animals like that better. I mean, I started that long ago because I knew I didn't want to wear my white lab coat around the animals.
Yeah. What I've heard this before in person from friends of mine that are vets. Why not white lab coats? Why would a dog and a cat care?
They call it white coat syndrome.
What's your feeling?
And you just the coats bristle up. They get scared because it's a PTSD thing, I guess. They've had bad experiences when they go to the vet with, getting their injections and getting their nails trimmed and having their anal glands done. And so they start to make that association. Yeah. They come in, they get picked up right away. They get put up on a stainless steel table. That's all scary stuff. So if you dress more like a friend, and they think they're coming into, a friend's house, and you get down on the floor and you use your high little voice, yay, come on, you want a cookie? It changes the whole vibe for the pet and for the pet parent. So yeah, the short, the first name thing goes right along with that.
Yeah. I just took my dog Gus today to his vet just to get a tune-up, a chiropractic tune-up, because he's an insane athlete. He's ridiculous.
Nice.
And we had a little spot in the middle, of the back, and sometimes it's in the above the hip, sometimes it's in the neck, but today it was in the middle of the back. And he's very trained. He's very composed. He's a gentleman. If you see him out in public, he's a good citizen. He's on all sorts of commands. Like, he could be off leash and behave perfectly from far away. But when he gets into this holistic vet's office, he screams like a lady, like a high pitch screaming, like female voice.
Excited.
It is.
Yeah.
Yeah. He screams and he whines when we drive up, and my vet throws I don't do this myself, but he throws things, he catches them, he throws the little treats, and he just loves him. And there's just an energy. There's an energy that I also think it's like I really like his vet. And so he picks up on that. There's a dynamic there. I'm relaxed. Of course he picks up on 100% of that. So, there's just a general friendliness. And I think some people, I haven't even really thought about this until just this moment. I think some people are afraid of their dog's vets, because it's like they're going to a doctor's appointment and they don't have a really good relationship with the doctor. It's usually like, oh my gosh, this person's going to tell me how much I'm going to be charged, or some bad news that I don't want to hear. And so both the person and the pet have this contentious relationship, and the energy just keeps, it just keeps circulating. It's kind of sad.
Yeah. That's when one of my colleagues in the training field had written a little booklet called End of the Leash, and you're on the end of the leash, and they can feel your emotions for sure. Or for that matter, a lot of times people will complain that, my pet gets anxious or starts barking as soon as we see another dog walking down the sidewalk coming towards us. And I'm like, well, but what emotion are you thinking when you see that big dog? And are you giving your dog a reason to think that he might have to protect you, or a reason, to be worried about that interaction?
The tension.
Exactly.
Yeah, the tension goes, and it's horrible. Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
Yeah.
But I also
that's my book is about a lot of that. My book is about a lot about what you think, what you say, what you feel is important to your pet. And that's when you start talking about holistic veterinarians and, what are we? What sets us apart from other veterinarians? It's the idea that holistic takes into consideration the mind, body, and the spirit of that individual. It's not just about herbs and natural foods. It's about thinking that the pet parent is part of that pet's world and environment. And so what that pet parent is thinking and providing for that pet is vitally important. So if you want to address that pet's health in a holistic way, you need to really think about what you're bringing to the table, how you're speaking to the pet, what you're thinking about the pet, how you're treating the other family members in the household, because that pet's paying attention to every one of those things.
Yeah, shouting and all that. And back to the differences in vets and how they operate. I mean, the 6-minute vet visit is what most people think is fairly, it's again, going back to putting myself in the spot of a person who goes to a holistic vet. It's this weird tension, almost like a principal comes in, the school principal, what we were always raised to fear, and we grow up and we become adults, but we then have these weird relationships like this, where a vet comes in, they speak fast, you're lost. You might be completely lost about what they're saying or how to make a decision, especially if it's a serious thing, a serious issue. And it's just this tension that you're in a space that you're not on your home turf. You just don't know how to operate in a vet's office. But when you go to a holistic vet, you usually get like anywhere between a good solid 30 with the vet.
I know. I was really, I'm really stuck on that 6 minutes. I'm like, who's doing the 6 minutes? I'm like, oh my gosh. I can't, even when I schedule for an hour, it's always longer than an hour. But I can't, I just don't feel like you do justice to any issue unless you're spending that time. You have to help people understand what the problems are. And it takes a lot of education, a lot of time in order to help at that deeper level.
Yeah, I so agree. Okay, so that's very interesting. So you mentioned your book, and it's Live with Your Pet in Mind. And you're talking about the whole holistic way of being with your pet. And I think you did a really good job of the summary that you just gave. Is there anything else that is in that book that, people, I mean, obviously without reading the book, but in terms of the summary, what other good takeaways are there when people buy your book on Amazon?
I would say people are very surprised at how much my book addresses the pet parent. So I cover all the good basic things to give them a taste of all the modalities that are included under the holistic umbrella, as I call it. For example, the natural nutrition, Western herbs, Chinese herbs, essential oils, acupuncture, laser therapy, all those things that you think of that a holistic vet might utilize. But I also spend a lot of time in my book talking about how important nutrition is for the pet parent, how important self-care is. That's one of the reasons I love essential oils, because they address the entire household. You might be using some lavender to calm your pet, but it's also calming you. It addresses the emotional, the physical. Topically, you use an essential oil to help some issue that's on your skin, but at the same time, when you're breathing it in, it's going right up the nasal passages to the amygdala, your memory center. It's bringing back, hopefully, good memories, or in the case of your pet, again, using an oil associated with good memories first, and then presenting it to them when they need a calming effect. So there's all these different modalities that I cover in my book that are definitely going to address the pet and the pet parent.
Yeah. So you yourself, you're certified in acupuncture, food therapy,
correct,
and Western and Oriental herbology, right?
Yes. So I'm very experienced in all of those things, but I'm also an integrative health coach for people too. And the reason I went out to get that certification is because I realized that as I sat there on the floor and I'm petting the pet and I'm doing my physical exam and I'm thinking about, well, how are we going to approach this, and what things am I going to tell this pet parent they need to begin doing, I'm at the same time down on the floor noticing the pet parent's feet and their face and their body language and their body size and all these different things. I'm thinking, how can I tell this pet parent to help this pet with weight loss if I'm not also addressing issues where this pet parent can't take the pet on a good long walk because they have arthritis or they have some other health issue, a heart issue maybe. And I had at my disposal so many products that I used on the animals that were also products that were great for people too. There are some companies out there that have been around for years that make excellent human and pet products. And I learned about the products by going to, for example, chiropractor seminars and learning about natural nutrition and glandular supplements. And they were using them on their human patients, the chiropractors were. Right. But I was applying that information to the pets. And then I realized, but I could be recommending this product for you too. But I felt like, but I'm your veterinarian. So if I'm going to say, here, you should take this, maybe I could say, well, because I'm an integrative health coach too. And so that's why I also pursued that type of education. And it's been super helpful.
Yeah. Well, I mean, a couple of things come to mind. I mean, the supplement world, whether it's Chinese herbs, Western herbs, other type of nutritional supplements, they work very similar in dogs a lot of the time, not every time, but a lot of the time. So it makes sense that you would notice that. And also, I think that we don't know a thing compared to what we will about how you're so intimately connected to your animals, and you all share, whether you have more than one or, whether you have a bird and a cat and a dog, whatever, you're all sharing a microbiome, which is so weird to think about. But we know that it all starts to look similar, and there's a lot of commonality in the microbiome when you live in the same house. So I just wonder, I mean, there's some really interesting magic in the microbiome, and if you have somebody with maybe a weight issue and a dog with the weight issue, of course it's habits, and it might be stress or whatever. It could be a lot of things, but I guess I just wonder. I'm just putting that out there.
Absolutely. I mean, you're more likely to have a client that is always eating processed food, not having any clue why kibble is bad for their dog. But as soon as they either start learning that they should be eating more fresh food and they should be eating foods that are fermented, that contain the good probiotics, then they'll understand better why, well, that would make sense then for my pet as well. Or it commonly works in the reverse, where I start talking about their pet. We get their pet on a fresh, raw, species appropriate diet. We get them off the kibble. Their pet starts in quickly becoming more energized, losing weight. Their mobility's better. They're jumping on and off the couch, whereas they weren't doing that anymore. And then the client says, boy, my dog's eating better than me. I should be eating some of this stuff. I'm like, yeah, you should. Yeah. And it totally goes hand in hand. And I tell people that they, if they eat some of that great sauerkraut, the good cold sauerkraut that you buy where they have it on the shelf in the health food store, the grocery store over by the kombucha, or oftentimes you can find it over where the organic vegetables are. Yogurt. And it's the sauerkraut that is fermented and cold, stored cold. And you start eating that, share it with your pet, give them just a tiny bit because it's really potent. And probiotics can cause diarrhea. They can also be used to treat diarrhea. But they're very important to that microbiome and to your gut health for sure. And you should be sharing that concept with yourself and with your pet.
Yeah. I mean, we say the same thing. People should be, we're not super bullish on just sauerkraut because it's just cabbage. But, if you can get into some superfoods and ferment those, all the better. I mean, that's why we exist. And we highly recommend everybody do it for themselves. Always do it for yourself if you can. And if you can't, come see us. So I know you're really pro raw pet food and nutrition. And I know that just kind of coming off this topic, Dr. Billinghurst always says one of the secret agendas he has is changing people's nutrition through their pets. He actually says it's one of his not so secret agendas because it's kind of out of the bag now. But it's the same thing that happened to me. When people see things, a lot of people will often do for others what they won't do for themselves, and especially their pets. So tell us your philosophy on nutrition and nutritional therapy. What is your overall philosophy on that?
Yeah. So, in a nutshell, I think a fresh, species appropriate diet is ideally the way to go. In my book, I mentioned something called Step Up the Pet Nutritional Ladder. And so in my visits, I try to explain that the first thing is you need to understand what you're currently eating or what you're currently feeding. And, what does that mean? What is it? How do you read an ingredient label and identify what really is in that food? That's for the first obstacle, because a lot of people don't know how to do that. And so because of that, they don't realize, how many bad ingredients there might be in that food, how many hidden bad ingredients are in that food, and how do you recognize and identify those things? For example, the synthetic vitamins and minerals, the hidden sources of glyphosate, which is Roundup. 1 out of 2 pets now getting cancer. So first step is recognize where your food or your feeding plan fits on this nutritional ladder. Is it at the bottom? Is it completely unbalanced? Is there a calcium deficiency? Are you home cooking and you think that's a good thing, but you're unknowingly destroying all kinds of nutrition, and you're going to end up with some pretty big deficiencies if you don't add some kind of vitamins and minerals to it. And then if you're going to do that, do you add more synthetic and create a toxicity, or do you add whole food source vitamins and minerals so that you're filling in gaps without creating a toxicity? Are you satisfied where your food fits on the ladder after you learn these things? And do you now need to step up the ladder? And by stepping up the ladder, you get further and further away from processed food and away from even the term home cooking to the food home preparing. And even at the top of the ladder, either balanced home prepared food or commercial products that are fresh frozen or freeze dried raw. And the huge key in that step up the ladder is also getting away from starches. So a lot of people don't realize that starch breaks down in your body to sugar, and that cancer cells absolutely need sugar or glucose as their fuel. And if we can starve those cancer cells, then we can prevent their replication, their rapid growth. And it's a way for us to help prevent or even treat and manage cancer simply with food. Food is your medicine. And I don't use any veterinary prescription diets at all in my practice. I haven't for over 25 years. And I'm able to manage and treat quite a few unique kinds of disorders that many of them, they'll be called incurable, but that's because they've never been managed with simply fresh, species appropriate food. And when we talk about species appropriate, well, I believe that our dogs and cats are carnivores. We are a little bit more complicated ourselves in that, I believe that we're primates, but there are, a whole variety, in my integrative nutrition health coaching course. One of the things that they taught us right away, I thought I was taking it to learn about, what's vitamin A and how does it work in the body and all of this. And what they taught right away is that there's a lot of different kinds of diets out there, vegan and vegetarian, paleo, keto. And even though a lot of those diets are really different, when people start going to those diets, the one thing that all those diets have in common is they are fresh food. They're not processed food. And so a lot of people with different needs will get better simply by starting to eat fresh food and getting away from the processed stuff that has all those chemicals in it. Yeah,
boy, that's so true. The other thing that comes to my mind when you were talking about studies and a lot of this research, it was done during kibble by kibble companies with dogs on kibble. So maybe we're not testing, or maybe those results aren't as accurate as they should be, especially for dogs that are raw fed. In other words, it might be easier to cure a dog that's raw fed and not so easy to cure a dog that's been fed kibble. So all of our perspective is skewed.
Yes, absolutely. Even our blood test reference ranges are based on kibble-fed dogs, not raw-fed dogs. So common one that, we all talk about, you probably talked about with other veterinarians in your videos maybe already, but the BUN, blood urea nitrogen, on your blood panels in raw-fed dogs is commonly a higher value above the reference range. And if a veterinarian doesn't know that or doesn't understand that, and they run a blood panel on a raw-fed dog and say, well, the B1 is up, I think your pet has kidney disease, that's absolutely not true. It's just that the reference range is wrong for that individual. And it's pretty important that conventional veterinarians learn some of this information, even if they're not on board. They need to realize that if they take a radiograph or an x-ray of a raw-fed dog and they see all these little white opacities throughout the intestines, that's not foreign body, that's bone that dog is eating. There's no obstructive process or anything wrong going on with that. That's totally normal for that dog. So, one thing that we need to do as holistic veterinarians too is try to have a relationship with these conventional veterinarians that want to say, well, oh, you're here for vomiting diarrhea. What do you feed? Oh, I feed raw food. Oh, that's why your pet's sick. It's like, no, there's a lot of causes of vomiting and diarrhea. Just because that pet is raw fed, you could really do that pet a disservice if you blow off that diagnosis and blame the raw food when it's actually something else. So we need to come together on a few things for the sake of all these animals.
So agree with you on that. Well, that's very interesting. So are you pushing people more towards raw, or if they want to cook? I mean, do you just meet people where they're at? How very specific and how specific are you on diets?
So I try to initially, of course, meet them where they're at, then provide the education so that they can then make their own informed decision about stepping up that pet nutritional ladder. I think that if you do home preparing correctly, that can be wonderful. I think that if you're doing home cooking and you're cooking the meat, you need to be educated and realize that when you cook that protein, you're creating heterocyclic amines, which are carcinogens. And the more high temperature that you expose to that, the more of those you produce. And anything that's a carcinogen that we can have control over, we ideally want to try to change that, simply because I'm sick of it. I'm sick of cancer, is epidemic. And I tell my clients, no matter what you come in the door with, if you come in with a new puppy, if you come in with an allergy, if you're coming in for an anal gland expression, or you're coming in to learn about raw food, we're going to end up talking about cancer, because we have to do something to slow that down and provide our pets with a good quality and longevity of life and avoid cancer, because that's what's getting them in the end. And if you don't recognize all the things in their environment and in their nutrition that's contributing to that, then you're not going to be very preventative or provide good enough management in that regard. And so, still home cooking, I think that is more that people just need to be educated to know that they shouldn't do it and they don't need to do it. That it's raw food that is more than adequate and it's what they actually need to do, but they need to know how to do it right. Because if they don't do it right and they jump into it too fast, they don't have enough guidance. If they are not told that when you change food, pets cleanse, we all cleanse. And a lot of people cleanse and detox on purpose, so it's not a bad thing. But it's pretty upsetting if your pet cleanses all over the carpet, right? But if somebody tells you ahead of time, we need to, do a gradual transition perhaps, and slow down this development of the cleanse. And that's just a hump to get over. And that once you get on all raw food and they're eating the adequate amount of ground raw bone or whole raw meaty bones in their diet, that they still will actually be very firm. If anything, it'll be too firm. And then we need to add more fiber. And then we have to mimic nature and think about, well, what are they eating in nature that's providing healthy fiber? Because we're not talking about starch. We're talking about fibers like fur and feathers and leaves and sticks. So we don't want to see fur and feathers on an ingredient label, but actually for the pets, that's probably what they need some of. But what could we do? We could give them pumpkin. We can give them green beans, blended dark leafy greens, all the greens full of antioxidants. That's just fabulous for cancer prevention, cancer management, for allergy problems, for the microbiome and liver detoxification, cruciferous vegetables, using your cruciferous vegetables, as you started talking about earlier, with fermented products. That's our carnivores in nature. They eat what's in the stomach of the prey. They forage. So they do eat vegetation. So it's very important that we incorporate that into their meat-based diet. I lost audio from you.
Okay, how's that?
Oh, there we go. It's back.
Better? Okay.
Yes.
Good. All right. Well, I was just saying, I know that you have some opinions about vaccinations and vaccinating dogs and cats. We have a couple questions. They're pretty basic questions, but we'd love to get them answered from our community if that's okay.
Oh, absolutely.
Number one question. Okay, great. Thanks. So this will be fun. What happens if you over-vaccinate is question number one.
So when you're over-vaccinating, so that's kind of a weird, broad term. Over-vaccinating means that you're giving a vaccine when they already have the protection. So first of all, number one, it's unnecessary. And secondly, it costs you some money that you're spending that you wouldn't need to be. And you're asking the immune system to take its focus away from the other things that it's doing on a daily basis and focus on that vaccination. You're also taking an added risk of a vaccine reaction. Now, a lot of individuals, even veterinarians, think that if a pet walks out the door after vaccination and it's okay, that it didn't have a reaction. Because that kind of reaction that they're talking about is anaphylaxis, where you give that reaction like somebody that gets a bee sting and all of a sudden they're down on the ground, they're going into shock. That's an anaphylactic reaction. But that's not the only type of reaction that you can get from a vaccination. There is immune-mediated reactions, and those are delayed, and many times it doesn't get correlated with the vaccination itself. And so if you're giving rabies vaccination that they already have the protection for, and then within 1 month or 3 months, it can totally be delayed, that you start having immune-mediated problem, which might be a life-threatening bleeding disorder. So probably many of your listeners have heard about autoimmune hemolytic anemia or immune-mediated thrombocytopenia. Those are immune-mediated diseases that absolutely have been correlated with vaccination. In fact, if you actually do read the vaccine manufacturer inserts, they list immune-mediated disease as a side effect of vaccination. And so, vaccine manufacturers really don't want you to take chances with their vaccine. They don't want you to give their vaccine after your pet has already demonstrated that it's had a reaction. So if your pet gets a big lump, red itchy area, vomiting, diarrhea after it gets vaccinated, you should report that to your veterinarian. Make sure that they document it. Ideally, it would be great if it actually got reported to the manufacturer or another facility that would collects data of that. But there is not any kind of mandatory agency that you can report to. But it would be very nice if we were doing that with pet vaccines and if we were accumulating that data. But you should be given the opportunity to read the manufacturer insert on a vaccine and make your own informed decision if you want to give that vaccine or not. And realize that reactions do occur. They are especially... they don't feel that rare when it's your own pet. No. There are quite a few puppies, honestly, that will have a polyarthritis problem where their joints will all swell within a very short amount of time, 1 day to 3 days after vaccination, where their joints will swell up. That could be very scary. They can't even get up and walk around. And so what happens a lot of times is that gets documented, but then the next time they are supposedly due for that vaccine, the veterinarian will say, well, let's pre-med them with an antihistamine, and then we'll vaccinate them anyway. And I've actually had some vaccine manufacturers tell me, you should heed that first minimal reaction as a warning, and you don't give that vaccine again. And they say that about their own vaccine right out of their own mouth. So in my opinion, the veterinarian that pre-meds with an antihistamine and then gives that vaccination again anyway is putting that liability on themselves. And they really should not be doing that. And they could be doing titer testing and checking to see if that pet needs that vaccine or not.
Yeah. So another question also about vaccinations is, can dogs overdose on vaccinations? And I would imagine the way it's phrased that they're asking maybe is the dose change from Chihuahua to a Great Dane possibly? I'm reading into that.
Yes. So honestly, there have been a lot of studies done that actually show it makes no difference if you give the 1 ml, the standard 1 ml dose to a small dog or a large dog. And that is true. There's a Dr. Ron Schultz, a PhD immunologist who was my instructor in veterinary school and has spoken out. He's probably worked with every vaccine manufacturer in the country. He's was a big part of helping develop titer testing. And he reached out to the AVMA and is partly responsible for helping them open up their minds and change to what we call core vaccines. So there's all different kinds of vaccines out there for dogs and cats, but the only ones that we should consider core are distemper, parvo, and rabies. And so a lot of the others you don't want to be giving. Now I've lost my train of thought. What were we first talking about here?
Well, you're doing great.
I get so passionate about this.
Yeah, no.
I'm sorry.
I think that we were going back to the question: can dogs overdose on vaccinations? And you were talking about 1 ml.
Right. Yes. And so he's the first one that taught me and my fellow students in veterinary school that dose of 1 ml is what it takes to stimulate an immune response, and that if you're going to have a reaction, it makes absolutely no difference if you get a 0.5 ml or 1 ml. And so, hopefully I can allay fears of that. And the reason why veterinarians are so adamant about giving the 1 ml dose and not giving a smaller dog a 0.5 ml is because most of us have been trained to believe, first of all, that the 1 ml is fine and not going to cause any more problem than a 0.5 ml would. And also, if you go off label, then again, you're taking on your own liability. So on the label, it says to give 1 ml. So I want to reassure you that it's really not about the volume in there. It's about the frequency. And so when we start debating this and we want to go to the legislature and we want to try to get laws changed, let's not waste their time arguing about a 0.5 ml versus 1 ml, because honestly, that does not matter. What we want to argue about is the frequency. And we do not want a law that says every 3 years you need to give your dog a rabies vaccination when we darn well know, even based on a titer test, that dog does not need that vaccination. And that's should not be a partisan kind of a issue. It should be anybody that loves animals and loves their dogs should all get on board with all their legislatures all across the country and say, listen, these dogs are getting this rabies vaccine when they do not need it. This state should allow for titer testing, because if that titer is positive and it's over that 0.5 value that Kansas State University studies have shown is protective, then we should be accepting that. And if they never need another rabies vaccine ever again, then fabulous. Then let's stop it. Stop taking that risk.
Right. Makes sense to me. MBD, minimally viable dosage, is usually a good rule of thumb for almost every medication.
Yes.
Yeah.
And the other concern with the vaccines is the adjuvants.
Yeah.
So that's, that's another issue that, we could get into and talk about. It's oftentimes not the vaccine itself that caused the problem, but it can actually be the adjuvant. And that's something that's added to the vaccine to help stimulate immune response. And so there's the thimerosal-free. So look for if you do need to get a rabies vaccination, look for the one. It's called IMRAB TF. TF stands for thimerosal-free. Thimerosal is mercury. And tiny amounts of mercury over and over and over. Oh, don't worry about it. It's just a tiny amount. Okay, well, when they break a thermometer on the floor in school, they bring in like the hazmat suits to pick up that mercury because it's so dangerous. And then they say it's okay to put in our fillings and it's okay to inject into our bodies, in a vaccine. It's like, no, it's not. It's a neurotoxin. And look at all the neurologic diseases we're seeing. Everybody left and right has a neurologic disease nowadays. Seizures are epidemic level, dementia, all neurologic stuff. And, we wonder why. Well, we have reasons why. We're putting all these neurotoxins into their bodies via vaccines and via the spot-on flea, tick, insect products. And those are all contain small amounts of neurotoxin, but you're doing it all the time. You're doing it every month. You're doing it every month for 10 years.
Yeah. There's some people that believe that when you mentioned glyphosate or the small amounts of mercury or whatever it may be, that the body's natural mechanism is to recognize an insult or an invasion of a toxin and to take care of it. So the liver, the kidneys, it goes into action. The body does what it does really well. But when it's too small, it evades that and it ends up being more insidious than even like a more extreme dose of a mercury. Do you prescribe to that? How do you think of that?
That and I think that is often how autoimmune diseases start. Because when the body is not successful at removing something, it can start reacting against itself. And that's where all of these different autoimmune diseases come from. And there are a lot of those as well.
Have them too.
Oh, for sure. Yeah. For sure. Well, autoimmune thyroiditis. So autoimmune thyroiditis in people, we call it Hashimoto's. In dogs, we call it autoimmune thyroiditis. So there's two different kinds of thyroid disorders. And when you run a full thyroid panel and measure for autoantibodies, then you know that your pet has autoimmune thyroiditis. And it's an autoimmune disease where the body is reacting against itself.
Wow, that's really interesting.
So it's not like an iodine deficiency, so that's different. So most veterinarians do only run a thyroid screening test, and they do a TT4. If they have the autoimmune version of the disease, the TT4 often comes back normal. But if you're actually looking at the autoantibodies, they can be totally out of whack. Mm-hmm. So, and in humans, a very similar scenario. In humans, they usually only measure a TSH. And so a lot of women have been misdiagnosed for years and years because nobody ever measured a full thyroid panel.
Yeah. When I've ever had to do a thyroid panel on my dogs just to check, I only do Dr. Dodd's. I think it's a gold. Does it make sense? A gold panel or something? Does that sound right?
Whoop, you froze on me again.
Can you hear me now? Hold on. Let's see something.
Yes.
Okay. All right. We just took a quick pause to make sure we're connected. So we're back, I hope. So let's continue with these questions. I'm very interested in getting these answered, and I love hearing these answers from you. So member of our community asks, what are the signs of severe vaccine reaction in dogs? Can you give us, I think you gave us a couple. Can you give us any more?
Okay, so we covered anaphylaxis, which is immediate, kind of a shock reaction They often go down and can't even get up, and they need intravenous fluids right away, antihistamine, epinephrine, steroids, those kinds of things. We covered the immune-mediated autoimmune hemolytic anemia, immune-mediated thrombocytopenia. Signs of those would be inability to clot. And so you might see bruising of actual little bruises, especially in the groin area where their fur is real thin. You might start seeing little bruisey red splotches in the whites of their eyes, red dots on their gums and the gingiva in their mouth. You might see bruising in their ears. You might actually see blood in their urine or rusty blood tinging in their urine. You could see actual blood in their stool or blackish stool, depending on if it's upper or lower GI bleeding. Of course, there's reactions where there's a lump, pain or redness around the lump. Sometimes with certain vaccines that can be accepted as like a little bit normal. Sometimes that can happen too if the vaccination is not given deep enough, if it's supposed to be sub-Q and subcutaneous under the skin and it ends up being given more intradermal, sort of in the skin. So sometimes it's how it's administered to and not necessarily a true reaction. If you're giving a vaccination in their leg, in the leg muscle, it could hurt because of the size of the needle that was used, how the needle was put in and pulled out. If the dog moved during the injection, you could end up with lameness or a sore leg. Again, not necessarily a reaction, but it could be the way it was administered. Definitely vomiting or diarrhea can be a reaction. Now, you could also have stress. You could have diarrhea just because of stress colitis. I went to the vet. I had a scary car ride. Maybe the vet gave a bunch of treats and maybe those treats didn't agree with the dog. And so then the day after the vaccination, they have diarrhea. And again, it may not have been a reaction. So, on the one hand, we don't want our pets to be over-vaccinated or unnecessarily vaccinated, but either distemper and parvo, for example, are real. And there was a study done on homeopathic nosodes where they gave a group of animals the parvo nosodes and then a group of animals that were vaccinated, a group of animals that received nothing, and then they exposed. And the only group that survived was the group that received the conventional parvo vaccination. So in that situation, in that study, honestly, vaccination was proven to be pretty important. When you give the vaccine, as far as how old the puppy is, matters a lot in how they handle it, whether or not they are able to mount an immune response or not. And when you give that vaccine can make a difference in how many vaccines you need to give. But I do think, I'm not anti-vax. I'm definitely anti-over-vaccinating. But I do think that there are some situations where certain vaccines, can be given, should be given. So in general, we don't want to, demonize all vaccines. We do want to do our best to recognize when it has been a true reaction or not. We want to make sure that that gets documented. And then we want to learn about, understand what titer testing is so that we promote that in our family, with our friends, with our colleagues, with our veterinarians that are opposed to it, that just don't understand it. Sometimes veterinarians don't want to do things because they're embarrassed, to be honest. They're nervous. They don't know a lot about it. They maybe don't know, well, what lab am I going to run that at? I don't have time today. I don't want to deal with this. So sometimes I think they charge a lot for something, honestly, because they don't want to do it. They just don't want to deal with it. They don't know how to read the results. Even the lab will say they're conservative in their recommendations on what to do with protective or a not so protective result. So, vaccines and titer testing is pretty complicated, and we all need to learn more about it, because what we're doing currently in our industry is not correct, not adequate. And you're right, the first part of it is recognizing, was it even a reaction or not? And the fact that a lot of those reactions are delayed responses and not even attributed to the vaccine itself, makes everybody think that there has been no reaction. Another very hidden thing, and this is probably a good answer to your question, is distemper complexes that basically gum up the glomeruli in kidneys, and are a contributing factor to the development of kidney disease. So in our dogs and cats, a lot of the so-called old age kidney disease is actually due to repetitive distemper vaccines that have been given year after year after year, because they've done biopsies with histopathology, honestly, necropsies. So when the pets, like an autopsy. So when these animals pass on, some of them have been, have had kidney tissue analyzed, and they have found distemper complexes contributing to this. Maybe some of your listeners have heard the terminology glomerular nephritis, which means inflammation of the glomeruli and the nephrons, which are little parts inside the kidney that perform the functions that we want the kidneys to perform. So wherever there's inflammation, then the function isn't doing so well. So if there is distemper complex all inside there causing inflammation, then that's a reason why you have kidney disease. Well, what if you never had distemper disease? Then where'd that distemper come from? All those distemper vaccinations that you've gotten over all the years. And so we know this is true.
That's so true. I mean, you wonder, I noticed so many more people talking about kidney disease, and I wonder, what's going on? How is that happening besides the kibble or processed foods? I don't have a real reason for it. This might be it.
Mm-hmm. It is definitely one of the reasons. Yes.
Yeah. Well, this just goes to show you and proves that my point that I keep trying to make to everybody is everybody should do themselves a favor, get a great holistic vet in your corner. If you can't do it locally, like Dr. Jodie, who is, by the way, in Scottsdale, if you can't get an appointment with a great vet because they're booked up or they're not local to you, get on a Zoom call and have a really great holistic vet walk you through your issues and the way of thinking around medical problems. And they can help you with, how to talk to your vet, tell you exactly what to request of your vet, and guide you through these problems. Because, we see this all the time. People are they're self-diagnosing and self-treating in comment sections, in forums, in Facebook groups, and they're getting flung around, by the tail by all different types of people who they literally do not know. And they're just convinced that those people have the answer, and they're wasting precious time. I think the thing that I try to emphasize for people is time is never on your side when you're dealing with a medical issue. You never want to lose time. So pull time forward for yourself and get on the phone or on a Zoom call or in person with a really great vet. Do you agree with me, Dr. Jodie?
Yeah, and you need to do some research to find even a holistic vet that kind of resonates with you. Yes, my home is currently in Scottsdale, Arizona, but I'm originally from Wisconsin, and I was in a little town there called Muskego. And many people were very surprised to find a holistic veterinarian in Muskego, Wisconsin. And now, actually, my practice is not in Scottsdale. It's in a little town called Fountain Hills. And so I want to throw out kind of kudos to this little town that I think is going to be changing right along with me, just like Muskego did years ago, is once you start reaching out and you get the word out and people start listening, and boy, word of mouth is still very strong, even though we've got Facebook and all of that. People still listen to their friends and their neighbors. So, your breath is not wasted by sharing this information with your friends and your neighbors. There are holistic vets kind of hidden all over the place in this country in little small towns. And we're doing our best, to get the word out. And it can be very surprising when you start seeing some, conservative pet parents coming along, where all they knew was kibble. And you got this little old man all of a sudden bragging to the guys at the park, like, yeah, I feed my dog raw. And, they're going, wow, what's going on with your dog? He could hardly walk before. And now he's running around. Oh, yeah, we're doing acupuncture. And they think it's, so fun to share all that information. So, I'm all about, we got to get the word out however we can and keep sharing this, because it's not a trend. It's not a fad. It's a good positive trend, and it's making a big difference for our pets.
Yeah, that's great. Well, it's been a real pleasure to have you today, Dr. Jodie. If you're interested in talking to Dr. Jodie, seeing Dr. Jodie, if you're in the Arizona area, vicinity of Scottsdale, go to Doc Jodie. That's DocJodie.com. And be sure to check out her book, which is on Amazon, and it's called Live with Your Pet in Mind. So thank you, Dr. Jodie. Really appreciate you being with us today and sharing.
Thank you. Thank you so much. This is great. Good luck, everyone.
Thank you. Yes, good luck, everyone. Always. We always want to wish good luck to everyone for everything. Have a great day, everybody, and thank you so much for watching. Take care, everybody. Bye.